Welcome to the Heart of Healthcare with Dr. G. This is a podcast that is unafraid to address current issues regarding top healthcare needs and concerns. Hello, and welcome back to our podcast. We're so excited to be here with you. And today we have Dr. G again. We're so excited. She's going to be every time with us. And my name is Toni Kiskin. I'm your host. Today we're going to be talking about loneliness and how it really can affect individuals that are end of life, individuals that are not end of life. And we're really going to have a pretty in-depth discussion about it. It's a tough thing to talk about, isn't it, Dr. G? But we're going to be able to discuss it and be able to really get to some of the meat of it. We've got some great individuals who have some studies on it. And so we really feel confident that you'll be able to go away with some good information. Before I get there, I'd like to go ahead and start off with our scripture. And today's scripture is 1 Peter 1:3. In his great mercy, he has given us new birth and a living hope through the resurrection of Jesus Christ. And we're so excited to be able to start off our podcast this way. So welcome back again. What I'd like to do, actually, Dr. G, is you're not going to believe it. We've got some questions.
We made it.
Yes. So today we've got some questions, and we do want to talk about those before we actually start going into loneliness. So the first question that we got actually is from Steve, and Steve is in Wildemar. And my understanding from Steve is that he travels a lot, and he goes out of state and really kind of has family that are in other parts of the country. The question that he had for us, Dr. G, is, if you are located out of state, how can you be sure that a hospice care that you choose is as conscientious as to what you described in your podcast? So what do you think about that, Dr. G?
Well, that's a good question, Steve. Thank you for reaching out to us. I hope we provided good information. So what I think about with that question is the quality measures. That's what he's asking about. We know that there are increasing quality measures each year Medicare puts in place to show this hospice is different from this hospice. Some of those things include if they provide continuity of care when symptoms are unmanaged. If you receive a physician visit in the last week of life, last 3 days of life, if the team, the IDT, visits you, the social worker and the chaplain. So those are some things, and it's actually compiled on a website. I think.
Yes, it's perfect. It's called Hospice Compare, and it's on the Medicare website. So You're exactly right. So that's a really good answer for Steve. And basically, they have stars, yeah. And on this Hospice Compare, they'll really be able to kind of measure out and look at the quality of what individuals, families, patients are saying about the different hospices, regardless of what state you're on. Medicare, as we know, is federal, so it's really good that way. I like your answer to that, Dr. G, and the reason why is because sometimes physicians or nurse practitioners don't even go out to visit folks, and they do everything from the nurses giving information, and then telephonically they'll give them some direction. But we know that that's not really the intention of having a physician or provider in your program, to be able to go out and see patients and families.
Yeah, I be in these streets.
Right?
That's a joke, my Elizabeth says, you're in these streets today. No, I do the visits. We are shout out to our sponsor, Destiny Hospice. I actually am a part of a thread that we keep when there's a change in condition, when we think someone's transitioning or their symptoms are not managed. I monitor that and do a visit so that we can make sure things are on track. Not just with the symptoms, though, the family, because there's also high anxiety with all this stuff, as you guys know. Let's take a breath.
Absolutely.
So it's making sure the family is able to manage the medications. They know where to call, just kind of settling things. And those are always special visits.
Absolutely. And I'm very proud of the fact that the majority of hospices that we are talking about do have physicians and other providers like nurse practitioners that can go out. But we do want to make sure that we do give that advice, that they do look for a hospice that way. The federal government really is very strict on their guidelines, so that Hospice Compare is a very good way to be able to take a look. The other question that was out there is, what types of questions should you ask a hospice when you're interviewing them?
Well, I would want to know, again, back to the quality indicators, when will I see a doctor? Because hospice is medical care. Sometimes they say, you'll hear a news report saying, oh, they decided to stop medical care and get hospice. That doesn't make sense. Hospice is medical care that we bring to you. Sometimes it's in the hospital for general inpatient, but we bring the doctor, the nurse, the team to you, and that's it. So yeah. I would want to know that. And a lot of times I'm not necessarily doing things, physical things. Many times I'm listening to the story that brought them to this bed, that got them debilitated. They're wanting to rehearse when they first found out, if they thought they missed it at some point, what they did, and they just want to be heard and make sure they did everything. So when I write those notes in Hospice MD or EMR, I feel like I'm writing their story. It's important, and I always ask, what did you do for a living, or
right,
whatever it is. So yeah, it's good. I want to know, when will I see a doctor, and how often are you guys visiting me? Who do I call in the middle of the night? So
absolutely. And I think also a really good question is, how long is it going to take you to get out here?
Ooh.
How far is your staff? A lot of times you might be triaged in between the drive, but you really don't want people that are that far out from the area that you're servicing folks. I think that that's a really good question. And I think that your question is very good. And of course, it makes perfect sense being a physician and knowing how important this service is. The next question that we have is kind of an interesting one, Dr. G, because it's about you. And they want to know, what are those rubber band bracelets on your wrist?
Well. This is like the evidence of my life. Last episode, we talked about me a little bit, and my family background and my journey. So the bracelets I wear here, this one is loci. So loci bracelet carry elements from the highest and lowest points on the earth. Mount Everest is the white V on the top, representing the high points in life, and mud from the Dead Sea is the black, and it signifies the difficult moments. And so there's another little blurb about it, but it's supposed to inspire you and just keep you balanced in those times, because we all experience the ups and downs of life.
Excellent. Oh, I love that, Dr. G.
And then the blue ones here are from my husband's application and sports program he has. He actually wrote a book during the pandemic. A lot of people did things during the pandemic.
Yes.
Started businesses, wrote books, changed things, did all kind of things. So for my family, my husband in particular, he wrote the Warrior Parent Playbook. Like I talked about last week, I'm the only non-athlete in my family, by the way, so I think me wearing all of them is me overcompensating for being the non-athlete in the family. But I live with 4 athletes, and the Warrior Parent Playbook is a book just to empower parents to use the characteristics that are built in sports to bring out the greatness in your child. So we all want to have great life skills, and a lot of times that's not taught. And so you'll learn a lot about me in there and how I did it. I'm an empty nester, and it's kind of around sports, but the hashtag is living greatness, and that's what we do. So these are the different bands for the different things that they work on each week. So teamwork, that's something we do in healthcare, growth mindset, adaptability, leadership, self-discipline, passion. So a bunch of things that we know. Everyone loves sports, or sports could be playing chess, it could be playing an instrument. So those intense things that require mental toughness, it's all about that and bringing it out in your child so that they know what they do on the field is also something they do in life. So
I love that. Mm-hmm. Now, why don't we give him a shout out as to what his name is?
My husband's name is Javelin Guidry, and he has the same name as my oldest son, who we mentioned. So we have to keep the K in there. His middle initial is Javelin K Guidry. K, like my first name.
Right. Yes.
Kind of like George W. Bush.
I like it. I like that you have the middle names.
So my husband, but again, this is his book, Warrior Parent Playbook, Javelin M. Guidry, Living Greatness, Utilizing Sports to Empower Your Children. Buy it for your grandkids.
Nice.
Or buy it for the parents.
Both. I like the idea of buying it for grandkids as well.
Yeah.
And I'm a new grandma today. So, yes, on Sunday. So I'm very excited.
Congratulations.
I'm thanking you for that the first time. So very exciting in our family. So I will be getting that book, Dr. G, for sure. All righty. So we got through our questions, and that is exciting. Please, if you have any questions or you're interested in finding out more about Dr. G or anything about the podcast that you want us to talk about, please feel free to give us a call. All that information is in our podcast, in the notes, and we can also have you feel free to call us at any time. And we are looking forward to those, and we'll answer questions as we get them in. All righty, so let's go ahead and jump into our loneliness. And loneliness, even the word itself can make you feel kind of sad, but we don't want this podcast to get you down. This podcast is really to empower you and to empower your families and to empower those so that you can move on from these kinds of things. And so that's an exciting thing of what we really want to accomplish here. And it's called Loneliness Because of Illness. And I don't know if very many people know this, Dr. G, but loneliness can kill. It absolutely can. And what's interesting is I was looking at some studies. It can actually shorten our lifespan by 25%. Yeah. So actually 26%. So that actually makes it more deadlier than obesity, alcoholism. And according to this study published, it can be one of the biggest things that can cause some disparity in families. So there was a study that was done by Judy Ho Gavaza, and she's a PhD, a clinical psychologist and associate professor of psychology at Pepperdine University. And she was really able to uncover that loneliness is a painful, emotional, and can have devastating impact on both your psyche and your physical health. Now, we know that you yourself, Dr. G, have actually delved into this when you were in medical school. So let's have you talk a little bit about that for us.
Yeah, well, actually, I didn't really dive into it a lot. You're talking about the project?
Yes, your project.
Yeah, the project.
More in your palliative program.
Yeah.
Right?
So this was the palliative medicine elective that I did in residency. I did a whole month in my intern year and another month in my second year. And so the first year, to culminate the palliative medicine elective, after we did all the CAPC modules and all that stuff and did the inpatient and outpatient palliative care, was to do an art project. It was assigned to us, and whatever you want to do. So right. I'll just share what I came up with, and I want to focus on highlighting the part that I created a mnemonic. Only the folks on YouTube will be able to see what it is here, but I'll share the picture. So I made a mnemonic using hospital, because
maybe bring it a little bit closer.
I've always loved hospitals. My parents used to work in hospitals, and I used to go to work with them back in the day when you could do that. It was Martin Luther King Hospital. I'd be coloring in the emergency room. But it's very comfortable for me. I volunteer there. Like I mentioned before, I would go on Christmas so that I could alleviate some of the burden that people felt for being there on Christmas. So spend time with my family, open presents, say, okay, I'll be back as a pre-med. I mean, obviously I didn't have a choice in residency. I was there. But I just did a mnemonic on hospital, and I have a little hospital bed there. And one side is black and the other side is white. That's the other side. So the dark side of it has the hospital bed. And I made it this way because it just reminds me of the loneliness that I would perceive in some of the patients. Like even if they were surrounded by family members, well-intended, loving them, being there for them, sometimes they were talked about and they actually didn't have a voice to express what they wanted. You know, family members fighting, advocating, well-meaning, you know, but I just saw that. So it's always my priority to hear from the person who's actually laying in the bed. You know, that's my thing. And some kind of way I figure it out. Every case is different. But so I made a mnemonic out of hospital. So the H stands for harm on the dark side. Physicians, we do the Hippocratic Oath. When we graduate from medical school and become physicians, we are to do no harm. And sometimes, you know, things can go too far, in my opinion, always with patient consent. But I'll just give an example. If someone has cancer, they weigh 80 pounds, you know, they're 90 years old. Should we really continue with treatments? I'm not saying that's an actual case, but right. Everyone can picture that in their head. So that's what the harm is there. Obscure is the O. Sometimes we're using medical jargon. The people don't even know what they're doing, what procedure they're going to. Just confusion. What's next? What's my next step? Scare. There's fear. I feel it. It's palpable. The fear and some of the things that are encountered. Pain. Pain is something that's very devastating and you know, makes an impact. Inhumane for the I. T, I put torture. That's more from my perspective, being in the middle of the night, doing the night call, for instance. One person that comes to mind was actually put on hospice, an older person, and couldn't breathe. And this person became delirious and started taking off the oxygen mask in the middle of the night. So the family is gone. This person is there 2:00 in the morning, taking it off. I get a page from the nurse, Dr. Guidry, can you give me an order for the soft restraints because they're taking it off, because that's what the family wanted to do. So that can get me choked up right there. Yeah. Because imagine having to do a limited restraint order for someone who
they don't want the oxygen anyway.
Yeah, that feels like torture for me. Yeah, doing
absolutely
CPR on someone who is at the late stages of cancer, or, you know, systemic, but you know, they want to do everything, and of course it's their choice. We respect that, but having to actually do it, right, really difficult. It makes it rough. Mm-hmm, yeah. Mm-hmm. So the T was for torture. A, apathy. You know, we on our side as healthcare professionals have to put up a shield to protect our hearts from that vulnerability you're seeing trying to seep up out of me right now. And then sometimes folks who've endured so many things with the healthcare system that we all know is broken, they're just so frustrated and upset. And a lot of times I feel like I'm cleaning up the healthcare system, the idealism of our healthcare system in the United States. When I go visit them, you know, they're saying all this stuff, and the hospital missed this, and why didn't they do this? And I have to explain things and kind of help them understand the processes, and then that gives them peace of mind. And so a lot of situations. So the L we got to, the topic for today, lonely. That was my last one there. So that's the sad side. The other side, I'm in there if you could see the selfie. So hospital, and of course palliative, huge and big right there. So the H stands for healing. O, openness, S for saving lives, palliative, P, I, intimate, T, treatments, for symptoms, A, appreciation, and L for love, because we create loving environments.
Absolutely.
So that was my art project.
That is beautiful. And I think that our folks that are watching really need to understand how important it is when you're looking at care for an individual and they don't want the care, and how that dark side that you showed that over there and going through each letter, how it really impacts them when they should be able to have their own voice.
Yeah.
And that, even though people may be around them, is a form of loneliness that actually becomes internal because no one's hearing them. No one's hearing the wishes that they want. And so I love that.
I'm like, wait, everybody, let me listen. So
right.
I have asked people to leave the room so that I could talk to the patient or give me privacy or whatever. Every situation is different. So those are really challenging. And then with COVID, we saw that people were lonely, having to have Zoom goodbyes to their families.
Yes.
And the nurses were conducting those sessions. I mentioned to you, my husband's uncle was in San Diego and he, said goodbye to the family on Zoom.
Yeah. And that makes it rough. And the thing about when you turn that over on your project and then it was all light and hearing all of those very positive words and knowing that people can be listened to, people can have a voice for themselves. And you mentioned the pandemic and you mentioned Zoom, and that was so tragic for them to have to go through that. In our program, a lot, we were in situations where families would call and they would beg us, you are caring for my loved one, I can't go in. They're saying that nobody can come in, their doors are shut, they're not allowed to have any visitors whatsoever. Food is basically slipped into them and they are going to die of loneliness. Is that possible? You can do something. And it was so heart-wrenching for us as folks that are trying to do the best that we can because we couldn't go in. And so the loneliness during the pandemic really wants us to be able to bring this out to you folks that are out there, that are watching our podcast, and realizing that even in these studies that were done before the pandemic, in saying that 20% of people that were lonely cuts their lifespan down by that 26%. Mm-hmm. And that people can literally die more than they can from obesity or even any other kind of serious illness. And we also know that loneliness can worsen at end of life. And you were just at a conference that spoke to that.
Yeah. I'm coming off the heels of two amazing annual conferences, the Society of General Internal Medicine annual conference. It was entitled Transforming Values into Action, and also the American College of Physicians. Dr. Fauci was there. Mastering Medicine Together. Those were just 2 weeks of amazing learning. And of course, I was in the palliative medicine updates. So one of them actually talked about what you just mentioned, the exacerbation of the loneliness in COVID patients. And there's a study here that was done by Dr. Abedini from Harborview Medical Center. She presented some of the findings, and they used a 3-item revised UCLA loneliness scale. And I have to say, go Bruins, since I'm a Bruin.
Yes.
But they used that, and they came up with some figures. So they said that 34% of the people, they were lonely, and they had increased odds of symptoms. I sent you some of those things like dyspnea, pain was worse, and then also increased odds of intensity at the end of life, meaning, more, do everything,
right?
That desperate kind of thing. Yeah. And so they pointed out how the end of life is a vulnerable time for lonely adults, especially those in the pandemic. They lost some partners. I do home visits for Medicare Advantage as a side gig. And for me, it's community service, just to reach some of the vulnerable. Right. And I encountered some people who lost their spouses during the pandemic. It was so sad. And it was really tough. And so the point of this study was to show we should consider screening for loneliness in our vulnerable patients. And some of the questions, I sent them to you, but it was it asks, do you feel left out?
Right.
Do you feel isolated?
Yeah.
You know, all these things. And so those are important factors, and that's where we can bring social work on board. Now that things are opening up and we are at the light at the end of the tunnel, we can revamp, restart our volunteer program, and people can be seen a little bit more. Obviously still social distancing,
Right,
but it's just important to pay attention to, you know, the loneliness, the visits. Many people weren't getting social contact. When I was doing some visits in assisted livings, memory cares, the cafeterias were closed. All the little games that they would do together, done. These people were stuck in their rooms, and
It's very sad. And that's why I really think that we wanted to bring this to the table. The pandemic, as you mentioned, is kind of slowing down a little bit more now. So we're hoping not to see it at the level that it was before. But we do have an 800 number, and I want to be able to share that with you so that if you are, or a loved one are in a situation where you really are feeling that loneliness, like what we're talking about, or you feel like you're screening yourself and you're feeling very lonely that way, or your loved one is, we'd like you to call 831-337-8469. And this hotline is really for those that are feeling lonely or isolated. And we want you to be able to have an outlet for that. And if you don't have somebody and you're really feeling like you need to just talk to somebody, we're here for you for that. And we will have this information in our notes for our podcast. But most importantly, we want you to know that we're here for you. Dr. G, myself, our team, we're here. We want to be able to help those, whether it's finishing up this pandemic, or you're just going through it because you're just lonely. You've lost somebody. You don't have those folks around you, those families, or you just feel like people are not listening to you. That's another thing that we talked about that can make you feel lonely. Well, we're going to go ahead and sign off for now. We plan on seeing you at our next one. Please continue to tell your friends, your family, your loved ones about us, and we'll see you next time. Bye-bye. Thanks for tuning in to At the Heart of Healthcare with Dr. G. Help us by rating us on iTunes, and don't miss an episode by subscribing on YouTube. And be sure to click that little bell to get notified about new episodes. We can't wait to see you next time.